I'm pumped. Let's let the healing begin.
You're using heroin, and you're having sex with anyone who asks. I'm not sure that these things are making you happy.
Well, that's where you're wrong, because when I'm doing them, I feel good and happy. And when I'm not, I feel like I want to die.
I actually identified with the therapist, just kind of making observations that are factual. Often when you do state the obvious, it has a different impact.
You sleep with your husband, too?
No, I'm sort of like a guy about sex. I just prefer to be detached.
You think that's what guys are like?
She was saying it in order to get a reaction, and when you don't have the reaction they're seeking, it brings things down a bit. I would probably ask her, is that your experience with men? She clearly has the experience, so I would want to go more to what she's experienced personally, especially in conjunction with heroin use.
You know, I can't remember being so calm in a long time.
That's a really common symptom in patients like yourself. Actually, your body's in survival mode, so what you're experiencing is shock.
I think I'm actually just fine.
When you're getting the I'm fine, I'm okay, I would say they're usually sent by somebody else.
Like, would you describe what you're feeling as a kind of numbness?
I'll describe it as fine.
Because certain patients feel
I feel great.
I avoid diagnosing quickly when at all possible. Sometimes you throw out different emotions and feelings that would be common given the situation and let them tell you no. You may not know exactly how you do feel, but if you put out a couple of feelings, you end up saying, oh no, that's not how I feel. And then you can help a client get a little further.
Look at me, son. It's not your fault. I know. It's not your fault. I know.
A lot of times we do say it's not your fault because it's true. Things as a child are ones that stick for so long that you have a sense that it is your fault.
It's not your fault. Don't with me, Sean, not you. It's not your fault.
A lot of times breakthroughs aren't necessarily the emotional breakdown, which is what we all seem to associate with it. Sometimes it's learning how to cope. Some of those breakthroughs are not as interesting to depict on film, but you're making progress just by being able to get back into the world and function even in blocks of time. I feel like film and TV is trying really hard to make therapy something that's more approachable and more normalized, and I love that.